And welcome to the Research Works podcast, brought to you in association with Curtin University and the Healthy Strides Foundation. Your hosts are Dr. Dana Poole and Dr. Ashley Thornton, and together we will interview world-leading researchers in the area of child health to support your practice in being more evidence-based.
Today on the show, we are very lucky to be joined by Associate Professor Asha Bowen, who is joining us to talk about CMV Awareness Month, which runs through June in 2021. Welcome to the show, Asha.
Welcome, Asha.
Oh, thanks so much for having me. Thank you.
Thank you so much for being here. Now, look, this episode is a little bit different to previous episodes, but with CMV or Cytomegalovirus Awareness Month, we thought it would be a great opportunity for health professionals who work with the pediatric population to hear from a world expert in the field of infectious diseases.
And just a little bit of background about Asha. Associate Professor Asha Bowen is most certainly an expert in the field that we're talking about today. Asha is a clinical researcher at Perth Children's Hospital and is the head of skin health and program head of vaccines and infectious diseases at the Telethon Kids Institute. Asha has over 10 years' experience leading infectious disease research and investigator-initiated clinical trials, which focus on issues significant to Aboriginal child health. In 2020, Asha became involved in COVID-19 research and is the chair of the Australasian COVID-19 Trial Global Steering Committee. Asha has received prestigious recognitions for her research, including numerous awards over the past few years, such as the Eureka Prize for Emerging Leader in Science and NHMRC Investigator Award as an Emerging Leader. So we feel very privileged to have her knowledge and expertise joining us today.
There is so much good stuff there. And I think for anyone who's involved in research, we look at the track record that Asha has, and it's just something to be so admired. And you're just really such an inspiration to so many of us. So look, I'm really excited about this because there's so many significant pieces of work that Asha's been involved with that have demonstrated knowledge translation. And we all know that's what we're all about here. So it's really, really exciting.
For sure. And in this world of information sharing and the fact that people can get so much information off the internet and various other sources that aren't necessarily the most reputable, there's a lot of misinformation out there. And we've certainly seen that with things like COVID-19. So we're really lucky to have an expert, a scientific expert joining us today. Now, Asha, normally the way we start these episodes is with a little bit of an icebreaker. So the icebreaker question that we have for you today is, would you rather talk to animals or speak foreign languages?
Oh, that is a good question. I would definitely rather speak foreign languages. I think I quite like finding out things about people, and I'm very, very curious. And I love the fact that here in Perth we live on Wajak Budja, and I love using the word kaya as a greeting from the Noongar language. But I also love speaking many other foreign languages. Sometimes I think in German because that's something I learned when I was in high school. But mostly it's all about English with me.
Yeah.
That's really cool. Well, I think I'm really curious what you think, Ash. What would you like to do?
Oh, I'm so torn on this one. I love the idea that I might one day finally be able to understand exactly what it is my dog is thinking because sometimes that thinking I think is questionable. But I have to agree with Asha on this one. The ability to understand and speak foreign languages, I think, would be so fascinating and valuable, even if it's just to know what other people are thinking about you.
I think we're all thinking the same thing. I would be exactly the same.
Yeah.
How many scenarios have you been when you're walking by a bunch of people and you're like, oh, I can hear them speaking Italian. If only I knew what they were saying. And yeah, maybe it's just the busybody nature of me. And I love the idea of listening to animals, but probably what my dog's saying is feed me, feed me, feed me, toilet, toilet, walk, walk. So I think maybe I could understand that one okay.
Absolutely. All right. Well, that was very insightful. Thank you. Thank you both. And I'm going to hand over to you now, Dana, to set the scene for us for CMV Awareness Month.
Fabulous. Thank you so much, Ash. The Cerebral Palsy Alliance, in collaboration with CMV Australia, have launched a national campaign to increase awareness and knowledge about CMV, which is an infectious cause of disabilities in newborn babies. Now, we are developing a greater understanding of the role of CMV, and there have been some really recent studies that have contributed to this knowledge. Of note, in a retrospective observational study that was undertaken by the CP Alliance team, led by Hayley Smithers-Sheedy, in the Journal of Pediatrics in 2017, it was found that of the 323 children with cerebral palsy, 9.6% tested positive for CMV DNA, and this was significantly associated with epilepsy. So really, having a greater understanding and awareness of CMV is really important as preventative measures can be put in place.
Thanks so much for that, Dana. So Asha, to start with, probably quite a broad question, could you explain to us a little bit about CMV, what it is and what the incidence of it is in the general population?
Yeah, great. So cytomegalovirus is what CMV is sort of short for. And it's a virus that causes really a flu-like illness. It makes, it's quite common in toddlers and young children. And by the time adults reach sort of 18 to 20, about 50 to 60% of the population in a developed world setting will have already had a CMV. And so most people don't get too sick with it. If you have a well-established immune system that doesn't have any problems with it, then you probably will have a mild illness, perhaps a fever, a rash, and it will pass. If you've got a compromised immune system, then you can get quite sick with CMV, and we do worry about that. We also worry about it when women are pregnant, and that's probably the story that we don't know enough about. So when we talk about that, we're thinking about congenital CMV. So we're thinking about the way in which the virus can pass from mother to baby if the mother gets the infection during pregnancy. And that's, I think, something that's really, really important for families, really, really important for young women planning pregnancies or currently pregnant, that they need to hear this story. And there are strategies we can use to prevent it.
Yeah. And really curious about that with regards to the difference between CMV and the common cold. Because it does, I mean, it sounds like there's some similarities there. Can you tell the difference?
It's pretty tricky to tell clinically which virus is causing someone sick. The common cold usually causes a runny nose and a cough. And so I guess that makes it somewhat different to CMV, which will probably make you have a fever, feel generally sort of achy and a bit unwell, and maybe have a rash. So there's a slight difference between those two. But it's often, it's often a spectrum, and without the appropriate testing, we really don't know. And probably as an infection specialist, we don't always make the effort to get the diagnosis right with this, because we don't have a treatment that we would use routinely for someone with CMV in the community. So we can look at someone and say, oh, you've got a viral illness, and we don't necessarily go to the effort to differentiate it out because we don't have antivirals that we would want to be using for people who have mild symptoms.
So CMV, as you might pick it up, transmitted from person to person is one thing, but you touched on this idea of congenital CMV, and that's when, well, my very basic understanding is when, say, a pregnant mother contracts a CMV and it's then passed on to the fetus. Could you just explain a little bit more to us about, how that might happen and what some of the complications of that might be?
Yeah, of course. So women who have never had a CMV infection are considered non-immune. They've never been exposed to that particular virus. And probably when I said 50 or 60% of young adults will have had CMV, it probably rises to 60 to 70% by the time women are pregnant. So most people have previously experienced it. Those who haven't, it's quite important to consider how we can prevent them from getting the infection during pregnancy so that they don't pass it on to their developing baby. And also, I guess, think about those who've already had it and what the other protection strategies that they might need. So the measures we can put in place, it's really, really important to follow pretty much the same COVID type of rules that we have gotten more used to recently. So that's staying home when sick, making sure you're washing your hands regularly, and particularly for women who are associated with toddlers, they're often, I guess, the cause of the infection. So young mums with a toddler in the household, or childcare workers, healthcare workers may be exposed to toddlers. And so making sure that we're washing hands after, wiping their noses, after changing nappies, because snot and urine are probably the two most common ways in which CMV can be passed from human to human. So really important to wash those hands. another message that I think is critical for women trying to prevent CMV infection is really about not sharing utensils, glasses, bottles, forks, knives, spoons with babies and toddlers who may have an illness, because that can be a potential exposure mechanism. And as parents who are busy and parents who are, managing a pregnancy, running after a toddler and things like that, some of those things can easily happen without even noticing. So I guess just bringing our attention to what are the strategies we do have available to us and how can we implement them. And that's why it's so important to talk about CMV, because there are ways we can prevent it, and to keep, help prevent some of the more serious outcomes that can occur when the infection passes from mother to baby.
Yeah, that's really great just to do that rundown. And you're really right. When it comes to the prevention strategies, we've all become a lot more used to it. The general public sort of know about, COVID-19 and being more aware about what you're touching and washing your hands. I'm really curious now because we work very much, for a lot of our listeners, we're health professionals. We work with a lot of children in clinical settings, sometimes in the home, sometimes clinically or within the hospital. And we do have a lot of measures that are in place, with regards to washing hands and things like that as well. What would your advice be for women who are working in this industry and maybe thinking about starting to have a family?
I definitely think that healthcare workers need to be aware of this. And we know that the profession is full of women and full of young women starting families. And so just having conversations and reminding ourselves that when we're washing our hands, we're protecting our patients from anything that we could be passing from patient to patient, but we're also protecting ourselves and our own health. And sometimes we don't prioritize that as highly as we should as healthcare workers. And so just that mindfulness and bringing our attention to how to keep ourselves healthy as well as to keep the people we're caring for healthy. So washing hands, wearing, like if you're in the hospital system, then wearing masks appropriately if someone's coughing or spluttering, and making sure that between every patient care, particularly when changing nappies, that hand washing is occurring is just really important because it keeps both the patients you care for safe, but it also keeps you safe.
Yeah, that's such a great message, and I think you're right. We have to remember to prioritise ourselves as well as the families and the patients that we're working with when we're talking about viruses like this. So, Asha, if a child is born with cerebral palsy and it's been attributed to this congenital CMV, what does that mean? Anything, I suppose, additional for that child? Are there common features of CP that's attributed to congenital cytomegalovirus? And are they contagious?
So there's lots in that question. And what we do know is that only about 10% of those women who get CMV virus during pregnancy will pass the virus on to their baby, and the baby will be born with symptoms. So 90% of those women, the virus will pass on to the baby, but they will be born without symptoms. So we call them asymptomatic. And so if I focus now on the 10% who have symptoms at birth, we might discover that they have failed their newborn hearing test. That's a test that's commonly done to all newborns. And it's a really, really important one because early knowledge about hearing can actually lead to better speech and language development for those kids. If a baby also, they could be born with what we call petechiae, which means spots, little bruises on the body, which means that the platelet count is not normal. Right. Or they could be born with quite significant, viral symptoms with a big liver and a big spleen. Right. So those are the babies that we pick up really early. And often those babies will go on to have a full workup for congenital CMV so that we can better understand whether they'll benefit from treatment with the antivirals that we do have available to us, as well as what their health and care needs will be over the coming months and years. And so most of those babies will have an MRI performed of their brain. Yep. And some of those babies will show features that are consistent with congenital CMV. And that is somewhat predictive of them developing cerebral palsy. Right. It's not the full story because, as we know, MRIs are not perfect predictors. That's right. They're just one element of the story. Yeah. And so really what we're doing as paediatricians and everyone involved in the healthcare industry, I guess as physios, as OTs, as nursing staff, as doctors, we're looking out for any early signs of, differences in the baby movements. developmental assessments, and then they can be predictive of cerebral palsy. So cerebral palsy is, I guess, not a diagnosis that's usually made at birth.
Yeah.
It usually takes months, sometimes even years, and hopefully fewer months as we get better at it so that we can put in place the early interventions that are required as quickly as possible. But that's, I guess, how some families find out about congenital CMV.
Sure.
And usually when we're trying to make that diagnosis early on, we can do a few different tests. One of those is we can, in the first 3 weeks of life, we can test the baby's urine. And if that comes up positive for CMV, then we call it congenital CMV. If it's after 3 weeks of life, then we can go back and look at what's called the dried blood spot or the Guthrie card that was tested at birth. It was collected at birth, and we can do CMV testing on that one.
Yep.
And sometimes that confirms the diagnosis for us. And so different ways to make that test. We also have a study going on at the moment for children who fail their hearing test to have a saliva test done for CMV. So we can find out as quickly as possible and as easily as possible whether this child might have congenital CMV. But there's also these 90% of kids who don't have symptoms at birth, and trying to find them can be really challenging. Some of the ways that we do find out as paediatricians is that there may have been, because the mum had an illness during pregnancy, there may have been CMV testing done for the mum during pregnancy.
Okay.
And so that might be an early indicator. It could also be that an amniocentesis was done at some point and CMV was tested on that. And sometimes we find out early on that that baby essentially has congenital CMV but has no symptoms for it. And those babies still can suffer from hearing loss, and they may go on to develop cerebral palsy, but at much lower rates than the babies who are born with the symptoms at birth. So much less likely to develop some of those things. But we still, if we know about them, we like to get them into a follow-up plan so that we can find out as soon as possible to identify what early intervention needs those families will have, and to make sure that they're cared for.
Yeah. Thank you so much for that rundown. I think it's so good to have those facts and that information with regards to the diagnosis. What do you have to say with regards to children who do have congenital CMV? There's a bit of misinformation, I guess, that's out there with regards to, is that child contagious? Are there extra precautions people need to have when working with that child? What do you say to that?
Yeah, that's a great question. And the child who's got symptomatic CMV does often have what we call CMV viremia. So that means that there is virus detectable in their blood for many months after birth. It also means that if it's detectable in their blood, it's detectable in their urine as well as in their respiratory secretions, so their snot and their saliva.
Sure.
And so it's really important for healthcare workers and family members working with them to continue to follow those same principles I was talking about earlier, which is around hand washing and about good hygiene practices with those babies. So if the baby is likely to cough or vomit, then wearing a mask is also something that healthcare workers may need to do. And so they are not super likely to cause other babies to get sick if they were lying next to them. But if they started to cough and splutter, then I guess that would be a small risk. And babies who acquire CMV, what we call postnatally or after birth, if they're born at full term, are not usually likely to get particularly sick from it.
Right.
They're definitely not going to get cerebral palsy or hearing loss from it. That's because of the virus that occurred during those early developmental features when the mum was pregnant.
Sure.
So they'll usually just have a mild illness and get better pretty fast.
Okay. So if that child is 2 or 3 years old now, down the track, it shouldn't be a concern that they'll still have the virus, but it just means you still should just exercise caution, because you should anyway, because of the age and the kind of work environment that you might be in. Is that correct?
Yeah. So usually after the first sort of 6 months of life, the virus gets controlled by the immune system of the body. And so we don't expect them to be infectious for their whole life. And most babies, by the time they are 2 or 3 or 4, wouldn't have those features at all. So not something to worry about for them for a long time, but probably in those first few months of life, definitely a concern.
Sure, that's really wonderful. Thank you so much for that. Well, I know we've got very limited time with you because you're a very busy person, and we thought we'd just quickly sort of make a bit of a pivot over to the whole situation around COVID-19. We are currently in lockdown as a result of a case that did appear in Perth, and for the first time, this has affected schools in the sense that there was an exposure site at schools. And now, even though there is a lockdown, schools have remained open. So we thought this would actually be a really good opportunity to talk to you about COVID-19 and children and what that means, because there's a fair bit of misinformation out there about that as well. So can you just give us a bit of a rundown? What's the current state of evidence with regards to COVID-19 and children?
Fantastic. So yes, another virus that I don't mind talking about. As an infectious diseases specialist, it has been an exciting couple of years, and it's super nice to talk about CMV first, because often COVID does get a lot of attention. They're both C viruses, but I think you're absolutely right. So what we do know about COVID, we learned really quite early in the COVID-19 pandemic, and that is that children just don't get nearly as sick with this virus as adults do. And we're still trying to unpack why that is the case. We have a few clues and doing a lot of laboratory-based research and, I guess, clinical studies to try and understand that better. But they just don't get nearly as sick as adults, or particularly elderly adults. And so globally, there are some children who have died, but proportionally, they are very few and far between. And most kids won't even need to go into hospital. Right. So they just don't get sick. They also don't seem to transmit this virus between child to child or children to adults very easily, which is an absolute surprise, because they transmit influenza and RSV like you wouldn't believe. And so usually we're just used to thinking of kids as snot vectors who are spreading viruses across the community and making their parents and their healthcare workers and everyone else sick. But COVID hasn't behaved like that. And so it's been like a little bit of a mystery, a surprise, and sometimes it confuses people because they're just not familiar and they think, oh, it must just be the same as every other respiratory virus. And it turns out it's not. And so I think with those two facts in place, we're now dealing, I guess, with some more transmissible variants. They're a little bit more able to pass person to person than the variants that we started with COVID. And COVID's caused by the virus called SARS-CoV-2, and it's an mRNA virus, which means that it's likely to keep mutating. It's mutating already, and it's going to continue to do that. And we're looking at here in Perth the Delta variant, and it has passed from person to person in relatively short contact opportunities. But it also has not passed from person to person, even in households and high contact opportunities. So it remains a little bit mysterious as to why that is the case. And I guess lots and lots of people globally doing lots and lots of epidemiological work, laboratory work, lots of science trying to understand this better. So here in Perth, we have, I guess, a situation where the state's gone into a lockdown and the government has decided to keep the schools open. And I absolutely support that as a paediatrician. I think it's a fantastic decision that WA government has made and has really prioritised that the well-being and, I guess, social, emotional, mental health of children and young people is best when they're able to continue to go to school. Because every school day actually matters. And so missing school days has a cumulative effect and can have, I guess, ongoing challenges for children, particularly those who have accumulated disadvantage already. So that might be a social or economic disadvantage, but it can also be through to developmental issues and intellectual disabilities as well. So every single day matters for every single child. And so I am quite proud of our government making decisions to prioritise education. It has, I guess, had some impacts for families because it hasn't happened before in Australia and it hasn't happened before in a lockdown period. So I guess people probably just predictably thought, well, why wouldn't schools close? Well, schools probably don't need to close because of two facts. The ones that I mentioned earlier, that children don't get that sick with COVID and that they're not as likely transmitted as adults, but also because we know how to prevent transmission to the best of our ability. So masks, hand hygiene, standing physically distanced, and minimising the contact between adults and children in a school campus are many of the strategies we've been practicing for over a year and a half now, and they continue to remain really important. So the schools have remained open. And I guess we will continue to learn about these new variants and understand even more so what it means for healthy children, what it means for children who have disabilities, and how we will continue to, I guess, be able to provide the right public health messages for all of our community.
Thank you so much for that, Asha. That was such a beautiful summary of COVID and COVID-19 and I suppose the current state of the evidence. And I think what's happened with the WA school system during this lockdown is a really nice example of being able to use the current evidence and the evidence that's available from a scientific perspective to make a really good informed decision. So thank you for sharing that with us. I just had a final, I suppose, question for you in relation to, I suppose we could target this at CMV and COVID-19 in regards to what your recommendations would be for future work in these areas and where you kind of see the scientific questions heading.
So I think particularly for CMV, we've been setting up a registry nationally so that we can follow these bubs who are diagnosed with symptomatic CMV. And some of them will get treatment. So we want to know if those treatments worked and if they had any side effects. And some of those side effects we need to talk to parents about actually might not appear till they're 20 or 30 and they're having their own children. So we really do need to have a process by which we can follow them up short term and long term and work together across all of the different disciplines that are involved in caring for kids with exposure to CMV and congenital CMV. So that's, I guess, one of the exciting research opportunities. I think that we're also doing some work, as I said, around the saliva PCR tests that can diagnose CMV more, I guess, easily for families. And I guess with the COVID work, we're continuing to try and understand. I was involved in the Detect Schools study last year, and so we're trying to find COVID in our schools. Unfortunately, with over 15,000 samples collected, we did not find a single positive, but we also didn't have any community transmission during that period in WA. So I think it was an important study in its time. There are lots and lots of other scientific pursuits from clinical trials to find out what the best treatments are that I'm involved in, as well as, I guess, my holy grail for COVID is understanding why it's so that children just don't get as sick and why they're not transmitting the virus. Now, that is absolutely fascinating, and I think it holds the key to how we might think about solutions and effective treatments for adults and saving lives ultimately. But we haven't cracked it yet, and we'll continue to work on it.
Oh, wow.
Lots of frontiers.
There's so much there to do. Look, Asha, thank you so very much. I feel like we could talk to you for such a long time, but we've learned a lot from you in just these 30 minutes. So thank you for taking time out of your busy schedule to talk with us. For everyone who's listening, remember the run sheet notes will be available on our website, researchworks.net. And if you want this recorded as part of your CPD requirements, remember there is a form that you can fill out and that will help you to keep a record of your PD as well. But for now, we say thank you and goodbye. And just reach out if you have any further questions with regards to this area. Thanks so much, Asha.
Thank you. It's a pleasure to be involved.
Thank you. All right. Bye.
Bye.